Music therapy is my CAM project. Um, CAM stands for Complementary and Alternative Medicine. It is pretty much an umbrella term for hundreds of therapies that are based on healthcare systems of people from around the world. Some examples are music therapy, massage therapy, acupuncture, herbal therapies, imagery, and many, many more. The history of music therapy. The earliest known written reference was in 1789 in an article titled Musically Physically Considered. In the early 1800s, writings on the therapeutic value of music appeared in two medical dissertations, the first by Attlee and the second by Matthews. Both of these students studied under Dr. Benjamin Rush, who is a physician and psychiatrist who was a strong proponent of using music to treat medical diseases. Many associations have been formed. Some of the early ones were unsuccessful, and there have been some successful ones. They, whether unsuccessful or successful, have attributed to journal articles, research, just getting information. Indications of this therapy. Some include military populations, whether recovering from injuries or post-traumatic stress disorder, and just dealing with their deployments and such. People on the autism spectrum disorder, Alzheimer's disease. They use music therapy as a response to crisis and trauma, and mental health, with anxiety and depression and things of that nature, and pain management. Adverse effects. I spent quite a while searching and scouring the internet, and I could not find any completely negative feedback or adverse reactions to music therapy. So I started thinking, and the only thing that I could think could be an adverse effect would be something like overstimulation. But that's about all I could come up with in my brain, or that I could come up with searching. Culture and music therapy. I believe all cultures use music therapy in some form or fashion. Music is just soothing to people, and it does play a huge role in culture. I think when I think of music and culture, I think of the people of South Africa. I think the drums and the bongos and the real music that they're beating out a drum. Health teaching. Limitations of music therapy. Um I did find two quotes. One, music therapy generally produces a positive result, but it is not recommended as a standalone treatment for serious medical and psychiatric issues, which does make sense. And another, while it is possible for any form of music to be used effectively in music therapy, not all individuals will find each type of music to be therapeutic. Which, if you go back to my cultural reference, or in any case for music therapy, some people like writing music, and that's therapy for them. Some people like to play music. Some people like to just listen. And in some aspects, one type of music will work for one person, and one type of music will work for a different type for someone else. So it's just a matter of finding what part of music is therapeutic to each person. Nursing research. I did find an article. It was titled Music Therapy in Alzheimer's Disease, Cognitive, Psychological, and Behavioral Effects. The study analyzed music therapy effects on patients who have Alzheimer's dementia regarding behavioral, psychological, and cognitive problems. There were 42 participants, 27 were women, various stages of the Alzheimer's disease, and I believe it said from 2 different facilities. And based on the results, music therapy had a positive impact on symptoms. Music therapy lessened symptoms of most neuropsychiatric disorders, especially anxiety and depression. Music therapy was found to improve delusions, hallucinations, irritability, and agitation. And those are my references.